world at large and India also, as part of the overall fraternity, had been dealing with COVID-19 pandemic for last 3 years. And I remember whenever we had taken support of media from Kerala, as well as again media from across the country, they had stood up like a wall. They had ensured in terms of creating the required public opinion and getting community support for management of COVID-19. So a very big personal thank you to all of you from my side. I had been interacting with few of you through video conferences specifically, and you had been such a great support. And I always make a mention that media is the fourth pillar of democracy, and that is the support we have always consistently got from you. So with these initial words, dear friends, today we are all meeting to talk about India's G20 presidency. And as has been mentioned, we basically will have our first health working group meeting tomorrow in Thiruvananthapuram, state of Kerala, God's own country. And Thiruvananthapuram is specifically the city of bliss. And we would like to sort of highlight to you what our presidency's priorities are, what had been the Honorable Prime Minister's approach, what has been the approach of Ministry of Health when it comes to health working group, and what is that we would like to achieve utilizing the power of G20. So we would like to run through a small presentation just to move further. Just to highlight G20 countries, why G20 presidency overall is particularly important. So G20 countries, they comprise of all the G7, the most developed nations in the world, 12 countries of growing global economic and political importance, and European Union. In 2017, the health track, that is the health working group, was introduced in the German presidency. And it was in 2019 that the health and finance combined track was introduced in the Japanese presidency. Just to sort of go into details, I would like to highlight when the health working group started, it was German presidency, which was the first presidency, which took up certain of the health priorities for global discussion in G20 forum. Subsequent to that, we went to Argentinian presidency, and after Argentinian presidency, it was Japanese presidency. Subsequent to Japanese presidency, it was presidency of Saudi Arabia, followed by Italy. Last year it was Indonesia, and now it is India which will be holding the presidency for 1 year. And in 2019, in the Japanese presidency, we talked about the convergence or the need of effective convergence of health and finance track so as to ensure that sufficient funds are made available and convergence take place and health is given the required priority. Why G20 is particularly important? Dear friends, this is a pertinent question which we would like to ask also. We would like to highlight G20 collectively represents 90% of world's GDP, 75 to 80% of overall international trade, 2/3 of world's population, and half of world's land area. So this is the critical importance that G20 as a group entail. And G20 had earlier been focusing primarily on international financial stability, but with growing complexity of developmental challenges, it has also started taking into discussion, into its fold, discussion on global health architecture, climate change, and sustainable development related issues also. And I'm sure you would all agree, with respect to multiple activities which are happening with the G20, health has taken its prime place or the primacy because of the fact that world at large has understood that without a sustainable health framework, it would definitely be impossible for even to have the required economic stability. And in terms of India's G20 presidency, we would like to highlight, 1st of December last year, India took the responsibility of G20's presidency. We took the presidency from Indonesia, and it will continue till 31st of November this year. And India's agenda is primarily going to be focused on being inclusive. It is also ambitious and action-oriented. What Honorable Prime Minister Modi ji had been clearly highlighting is to ensure that voice of Global South is heard through the India's G20 presidency. Our theme is also based on our India's philosophy of Vasudhaiva Kutumbakam, which we are all aware means whole world is one family. That is why our theme is one earth, one family, and one future. And I always make a mention that when it comes to this theme, while this being the overarching theme for India's G20 presidency, This is particularly relevant for health working group because we all aware that in an infectious disease, in a pandemic, no one is safe till everyone is safe. So we believe that this particular theme is most aptly suited for the health working group primarily. And in G20, just to also bring to kind notice that we have a concept of Troika. Troika means the current presidency, along with the past presidency and the future presidency. And if we see past presidency being Indonesia, India being the current presidency, and Brazil being the upcoming presidency, this is a very critical element in terms of overall understanding of how G20 has been progressing. What we would like to submit and highlight to you that all the three countries being developing countries, being part of Global South, so this actually is one of the very important approach which Honorable Prime Minister has specifically highlighted, that this is the time when India takes over or takes the responsibility of being the voice of Global South, which primarily focuses on ensuring equity across the world, equitable growth across the world, and ensuring that when it comes to specifically on health issues, we are able to ensure that no one is left behind. This is also, dear friends, a very important opportunity for us to highlight India's diverse culture and traditions. That is why when multiple health group meetings, multiple meetings in different health groups, be it finance track or Sherpa track will take place, we would be organizing these meetings across the country. So there will be around 200 plus meetings which will happen in 50 cities across 32 different work streams over a period of the next 11 months. And this again in Kerala, tomorrow we'll initiate our first health working group meeting also. So from a health track perspective, what is very critical to highlight is basically this, because of the COVID pandemic, and since because of the COVID pandemic, it has been brought to fore that health becomes the converging point for all growth and even the economic stability across the world. So this has become one of the most important working group within the G20, and we would be focusing for a resilient, responsive and inclusive global health architecture. The point to submit here is specifically to highlight that with COVID-19 pandemic, there is a bigger discussion going on across the world. What should be a fit for purpose global health architecture for the future? The challenge for us is that, is it going to be the next pandemic which world will see? Or is it not a fact that pandemics may happen? Question is not if it is the last pandemic, question is when would be the next pandemic. So is world going to be taking into account the learnings of COVID-19 pandemic and health emergency management to create a robust global health architecture which is fit for purpose to manage future health emergencies, is what we would be trying to focus on. Similarly, our focus also within our health working group is also to ensure that whatever has been discussed in earlier presidencies in terms of the health working group priorities, and those agendas, they are brought to fore, they are converged, they are consolidated, and we ensure that the delivery on those agendas take place in terms of overall framework, that how do we consolidate the ongoing action and bring, as Honorable Prime Minister said, an action-oriented and decisive framework is put across the world. There are three priorities which Indian health track has identified, and I am sure you would relate to all the three priorities. First priority, as I submitted, is health emergencies, prevention, preparedness, and response. And it will also focus on the agenda of One Health and antimicrobial resistance. Dear friends, you're all aware that most 70% of the diseases are primarily from zoonotic origin. And if they being of zoonotic origin, the concept of One Health take the required primacy. So world at large is now talking about One Health approach being an integral part of being prepared for managing future health emergencies. Similarly, antimicrobial resistance, we are all aware of the fact that it is antibiotics which had been a great support to world for the last few decades in terms of supporting management of diseases. Antimicrobial resistance is cited as a silent pandemic and a threat for future. So what needs to be done in terms of managing this challenge also becomes part of health emergency management and being prepared for managing health in future. Within this framework, as I submitted to you, that when across the globe, the new global health architecture is being discussed, how does India, under its G20 presidency, bring that convergence in terms of ensuring that a fit for purpose, a non-fragmented, a non-siloed global health architecture is prepared, is what will be our major focus area. Similarly, the second of our health working group priority is strengthening cooperation in pharmaceutical sector with focus on access, availability, and affordable medical countermeasures. Here I would like to specifically mention that this is in extension of the ongoing priority, that is the first health working group priority for being prepared for future, and also the ongoing priority from Italian and Indonesian presidency, wherein we talked about the need for ensuring that there are medical countermeasures wider availability to the world. It is also a fact that whether it is R&D or whether it is manufacturing, most of the time it is generally available in few countries of the world, and global south LMICs to that extent do not get the required access. Similarly, also it is equally important to highlight that can this priority be used to create that framework where regional level R&D networks for medical countermeasures can take place. Let me kindly explain what I mean by highlighting medical countermeasures. So when we talk about medical countermeasures, are three elements specifically: vaccines, therapeutics or drugs, and diagnostics. So from a medical management perspective, all the three elements of medical countermeasures are equally important. And for all these medical countermeasures, how do we create network of R&Ds across the world so that it is widely available across the world to countries at large, is what we'll be focusing on. Similarly, once R&D gets supported, there is also need to ensure that wider manufacturing across the world can take place. And as part of that framework, we'll be focusing on requesting and utilizing G20's advocacy power to try to create those frameworks where manufacturing of vaccines, therapeutics, and diagnostics can take place widely across the world. We had also realized during the ongoing COVID-19 pandemic that even if there is R&D happening across the world, R&D in turn is supporting manufacturing across the world, but equitable distribution had still its own challenges. There are countries which do not have sufficient resources to make those vaccines, therapeutics, and diagnostics accessible because they are low resource countries. And there are also countries which have high resources and they can book production for 3 times their population also. So that being the level of inequity across the world became the reason that access to COVID tool became access to COVID tool accelerator, shortly known as Act A, came into picture to ensure that funds are pooled and low and middle income countries were provided vaccines, therapeutics, and diagnostics through this particular initiative at global level, something which we call as Global Medical Countermeasures Coordination Platform. Now, since COVID-19 pandemic is on the waning trajectory, world at large is also going to think in terms of what would be the future medical countermeasures platform for future health emergencies. So this would be again one of our focus. So this, if I were to reiterate and highlight what we are trying to do under this particular health working group priority, will be focusing on creation of regional level R&D networks, creation of regional level manufacturing networks, and a global medical countermeasures coordination platform for all 3 medical countermeasures, that is vaccines, therapeutics, and diagnostics. It is pertinent to highlight that if you see the present pandemic was supported primarily because of availability of vaccines. And if we see the last pandemic which world had seen, that was 2009 H1N1 pandemic, it was supported by availability of therapeutics intervention, oseltamivir tablet. So what is relevant is that world collectively should be focusing on all the 3 elements, be it therapeutics, be it diagnostics, be it vaccines, across all platforms, and how do we create this paradigm that we are ready to manage the future pandemic would be our focus, so that world is better prepared to manage any future health emergency. Third element within this we would like to add, kindly see wherein we made a mention of access, availability, and affordability. Now what we have seen in the world from India's perspective is that in world arena, discussion generally takes place on accessibility, whether It is the countries have access, whether the countries have availability of the medical countermeasures. But from India's perspective, as you are all aware, be it generics or be it the fact that when it comes to manufacturing within country, we always talk about value for money approach. We also talk about affordability. A case in point, I would like to specifically highlight, if assuming RT-PCR test is available in India presently for around $4, that is around 200 rupees, versus RT-PCR test is available in certain other countries at $100. There is a differential of 25 times, $4 versus $100. So from India's perspective, in India's G20 presidency, we would also like to talk about the concept of value for money approach when medical countermeasures are prioritized. Because if world were to create a fund to provide these vaccines, therapeutics and diagnostics to low income countries at some point of time, what medical countermeasures we prioritize will impact the funds requirement. Whether it is going to be $4 RT-PCR test or whether it is going to be $100 RT-PCR test makes a difference of 25 times in the fund requirement. So the concept of value for money approach, concept of sustainability for these medical countermeasures through focus on affordability is another element which India would like to focus on. Dear friends, third of our priority is digital health, supporting universal health coverage and improving health service delivery. So herein specifically I would like to highlight, we believe that technology is evolving so fast and it is encompassing all levels of health service delivery. Be it, for example, if I were to give a very classic example, that when India was passing through multiple stages of managing COVID-19 and people were forced to stay at their home, India launched e-Sanjeevani telemedicine platform. People out of fear of infection could not come out, but they still needed health service delivery. And when we launched this telemedicine platform, today we do more than 400,000 calls on an average on that telemedicine platform. And not only 400,000 calls, we have done more than 9 crore consultations through that telemedicine platform, making it the world's largest telemedicine platform by margin. Now, when we talk about universal health coverage as an approach to ensure that no one is left behind, it is these type of technology initiatives which have ensured that there was health service delivery available to a common man when there were challenges posed by COVID-19. So that is where I would like to further give an example. One national NGO did an analysis of telemedicine in Jharkhand, e-Sanjeevani platform, and came back with the data. It said that per telemedicine call is saving on an average 24 kilometers of travel time for patient, and on an average 941 Indian rupees in terms of that he did not have to spend it to a private health facility to just get the similar advice. Now please translate that into kilometers, 24 kilometers by more than 9 crore. That many kilometers of travel time has been saved. 941 rupees multiplied by 99 crore calls, more than $1 billion has been saved. So what we are trying to submit here, we believe that it is technology and technological interventions which will ensure that we will be able to provide required services to public at large and ensure universal health coverage. In this context, I would like to highlight that even when it comes to management of COVID-19 within our country, it has been the COVID-19 India portal, it has been our COVID vaccination platform which has ensured that we were able to manage our programs well, and we were able to ensure that whether when the first dose is due, when the second dose is due, and whether there was an adverse event following immunization, all those approaches could be monitored, and we are able to do more than $2 billion vaccine doses across the country. So with that as a framework in mind, we had brought this as a third priority, how digital health can support universal health coverage and how digital health can improve health service delivery. We would also like to propose in that context that we would be working with G20 countries in terms of ensuring that wider use of technology can take place across the world, and how India has taken up an initiative in terms of Ayushman Bharat Digital Mission by creating an architecture framework, by removing silos in digital data, And by focusing on creating electronic health record of every citizen of this country, similar approach, similar initiative needs to happen within G20 countries and world at large. This is what we would be focusing on. Dear friends, we have series of meetings lined up with respect to India's health working group priority. First event, as you are well aware, is going to happen on 18 to 20th January 2023. This is happening in this town, City of Bliss in Thiruvananthapuram. And second event will take place from 17th to 19th of April. This will be happening in Goa. Third event will take place in 4th to 6th June, and this will be happening in Hyderabad. Again, one of our town known for its IT prowess as well as the pharmaceutical successes. Fourth health working group meeting will be the last meeting, and it will be followed by a ministerial meeting where all the honorable ministers of the G20 countries will congregate and there will be final declaration. This will be happening in 17th to 19th August. Also, in most of these health working group meetings, as per the historical practice, there is also a concept of side event. Side events are primarily events organized along with these official meetings of G20 delegates, where few of those priority areas or few of those areas which a country would like to focus on are highlighted. So, along with the first health working group meeting, we will also be having a side event on medical value travel. I would like to explain, as you are all aware, that there are places, there are geographies within the country or abroad also, where either certain treatments are not available or certain treatments are available at much higher cost. So can G20 countries come together, discuss in terms of creating facilitating environment, creating a policy imperative, whereon if a person is in a geography where either that treatment is not available or that treatment is available at a much higher cost, he can travel to another country or another location and get the treatment done in right time. Can we collaborate on that as a framework and ensure that universal health coverage and value-based healthcare is supported through this particular initiative? So 2 days out of our meeting on the first health working group, this side event will also take place. And as part of that initiative, we would also be highlighting India's success, India's approach towards holistic healthcare. And that is where we are also going to take them to one modern hospital as part of the field visit, which is KIMS Hospital. And we'll also be taking them to Soma Thiram Ayurveda Resort, where the traditional medicine for curative, wellness and therapeutic purposes will also be discussed. Second of our health working group will be accompanied by a side event on digital health, wherein what initiatives are happening in the digital health sector, how it can support health service delivery will be highlighted, India's startup sector, India's approach in terms of what can be done to ensure that whether it is use of artificial intelligence, whether it is use of Bluetooth enabled devices, whether it is use of ensuring cutting edge tools like Internet of Things, eICUs also would be discussed and highlighted. Third of our health working group will be supported by a side event on collaborative research network, where for all the three medical countermeasures, that is drugs, diagnostics and vaccines, can G20 countries discuss among themselves and think in terms of creating a collaborative network amongst countries so as to ensure that discussion and technology transfers can take place with respect to the research agenda. On the ministerial meeting and the fourth health working group meeting, which will be the culmination of our health working group meetings, we also will have two co-branded events. As I mentioned, that traditional medicine, and I'm sure since I'm in Kerala, which is again a hub for wellness for not only for the country but for world at large, we would also like to highlight, we want to organize a summit on Global Center for Traditional Medicine, which has recently been put in India in Jamnagar by WHO. So this is a global center. So a summit for that also will be organized, wherein the evidence-based traditional medicine supporting health service delivery will be highlighted and discussed. And as well as a global event on medical value travel is also planned to be organized, which will be taking this agenda, which we will be discussing the first side event here further and trying to create consensus and advocacy on the issue also. Again, we will be looking forward. Delegates have already started arriving to the City of Bliss, and tomorrow we'll start our first health working group meeting. There will be effectively thematic discussions on all the priorities, the three priorities I have indicated to you. And we will have not only representative from G20 countries, we have 9 invited countries also which will also be joining us, and approximately 30 international organizations across the world working in health sector, they will also be joining us, be it Gavi, which is the Vaccine Alliance, be it United, which is working on therapeutics, be it Medicine Patent Pool, be it other international organizations working on different agendas related with health. We are also utilizing this opportunity to showcase, exhibit India's approach towards universal health coverage through the concept of Ayushman Bharat. So there will also be exhibitions organized in both the side event as well as the main health working group meeting. The side event exhibition will also show prowess of India's Ayurveda as well as the modern medicine, and wherein people from across the world are coming and getting themselves treated or coming here for wellness. And similarly, as I mentioned, side event on medical value travel will effectively showcase the holistic and integrated healthcare approach being adopted in India. And this is first health working group meeting will take place in Kovalam. Similarly, the side event will happen in Obai Tamara. And we always mention it, as I submitted earlier, that we always believe that media has a very important role in terms of building public opinion, in terms of also highlighting not only the public health challenges and their suggested solutions at national and global level. So we would seek your support in terms of highlighting India's priority, highlighting the rationale behind choosing those priorities, and how they can support world at large for being better ready for managing any future health emergencies or providing better health service delivery. We would take your help, look for your help in terms of creating awareness around our health priorities, their importance, and building consensus among stakeholders, mobilize not only the world at large, but also community at large, including organizations and academia, for action on the deliverables I had submitted to you. This is also, as I submitted, an element to showcase India's rich and diverse culture and traditions, also elements of India's initiative in health sector. This is a great opportunity for India to showcase those prowesses also. We would also seek your support in terms of highlighting these activities also, so that India can actually attain its arena of place in the World Committee. Thank you very much.